step a little bit away. Thank you. Good afternoon, everybody. The Secretary to the Government of the Federation, honorable ministers here present, directors and directors general, ladies and gentlemen of the press. What I'm going to say rests on the very strong first part that the Secretary to the Government already mentioned. And as of today, the 23rd of April, 2020, 873 people in 25 states and the Federal Capital Territory have been confirmed to have COVID-19 from 9,522 tests. The 91 additional confirmations are as follows: 74 in Lagos, 5 in Katsina, 4 in Ogun, 2 each in Delta and Edo, 1 each in Adamawa, Kwara, Oyo, and the FCT. 197 persons have been successfully treated for COVID-19 and discharged home, while 28 deaths have sadly been recorded. Like yesterday, the high number of new cases is a manifestation of more efficient testing, but also of ongoing community transmission. The federal government, through the Federal Ministry of Health and the Nigeria Center for Disease Control, continues to support preparedness and response to COVID-19 in all states and the FCD. Rapid response teams are working closely with state emergency operation centers to strengthen operation activities. Speaking about the structure of our response, which is to test, treat, trace, and isolate, the idea is to test people based on set criteria, such as travel history, contacts with persons who have traveled, the symptoms, or persons in clusters of those of where there is high prevalence, and all this is for the prospects of high yield. Persons who test positive in treatment are placed in treatment and isolation, and we trace all their contacts and quarantine them for 14 days. Today, NCDC laboratories have capacity to test 1,500 samples per day in 13 laboratories across the country. However, we are testing an average of about 600 samples per day, because that is all the samples collected and sent for testing. Which means that there is a certain underutilization, and the factors implicated in the process may include surveillance, sample collection, and mode of transportation, which can be improved upon to increase operational efficiency. This is where a little investment can help, and the results of such intensification of efforts can be seen especially in Lagos, where improved logistic management also increased sample collection and significantly reduced turnaround time. As we further increase our testing capacity and accredit more laboratories, and even more robust sample transportation and infrastructure will be put in place to promptly convey samples to any of the 13 laboratories that have been activated so far. Nigeria's strategy is to admit all persons who test positive for COVID-19 into designated accredited treatment facilities to contain the spread of the virus and ensure prompt management to forestall complications. I urge all individuals who test positive for COVID-19 to report at any of our designated isolation and treatment centers. The Federal Ministry of Health must be able to account for all the infected persons and ascertain the containment of this infection. States are strongly encouraged to ensure that all persons who test positive for COVID-19 are admitted at the designated center, and to ensure that the public suffers no hazard from choices that individuals wish to make. The Federal Ministry of Health can assist all persons who are seeking privacy, security, and anonymity to find the best treatment options. Contact tracing is key to containing the infection. As persons are confirmed positive for COVID-19, we trace all the contacts that they had in the preceding 14 days. This is a tedious and meticulous activity which is conducted by NCDC along with other the states concerned, and for which the cooperation of the public is always sought. Nigeria Center for Disease Control has finalized the contact tracing guidelines with all states to actively aid this case finding. The other key factor I mentioned before in the response is where capacity is needed after positive testing. It is to isolate and treat all persons found to be positive for the virus. Especially challenging, as has been said here before, are persons who test positive but have mild or no symptoms, but they are infectious to others. These persons make up a good number of the cases we are handling in Nigeria, but they must nevertheless be referred to isolation and treatment centers with accredited infection prevention and control protocols. Failure to isolate such persons may constitute a risk, but also a risk to the individual himself, because his condition can change suddenly. Infection can persist in the community, and transmission could continue if such persons continue to mingle in society. I applaud all our health workers in the front lines of COVID-19 pandemic, and the government will continue to provide you with the necessary personal protective equipment. I urge you all to take the necessary precautions for your own safety. Please do not try to treat patients without using adequate PPE, and frontline workers must undertake refresher courses, training in IPC at intervals. This advice is necessary due to the number of health workers who have tested positive. There are over 40 now, or others who have had to be quarantined in the last two weeks due to exposure and are therefore not able to contribute to the health sector effort. I urge you all to remain vigilant in line of duty and maintain, as I always say, a high index of suspicion. All citizens are once again, as I do every day, remind you to use a mask or face covering when leaving your residence, preferably, and also to practice hand and respiratory hygiene and physical distancing to avoid mass gathering and non-essential travels. Every travel you make nowadays, particularly if you're in a crowded bus or a crowded minivan, is a risk to you, because you will not know if whoever is sitting next to you is a silent positive. So avoid any travel and postpone any travel that is not a matter of life and death. Individual actions will determine the success of the actions being taken by government. To stop the spread of COVID-19 is therefore a collective effort. If you suspect yourself or anyone around you may have symptoms that are suspicious, call the number we have always given, 112 or 0800 9700 0010. With time, you will be able to find that the activation of our ambulance service will be available to pick those who are with symptoms or those who have COVID-19 diagnosis to take them to treatment centers. Resources and real-time information can be found on the social media handles of Federal Ministry of Health and NCDC, and the Federal Ministry of Health website, and the NCDC COVID-19 microsite, which is COVID-19 ncdc.gov.ng. Please stay home, stay safe, and take precautions. Thank you.